Hi, my name is Jennifer Roeder. I'm a communications consultant for APFED. I'd like to welcome everyone to today's episode of APFED's EOS Support Webinar Series. We are pleased to have Patti DeMuri join us today to talk about self-advocacy in the healthcare system. She brings a wealth of knowledge and experience to families dealing with rare and chronic illnesses. Patti is a rare disease coach and patient advocate, certified patient navigator care coordinator, mom to 3 adult children, 2 of whom were diagnosed with EOE and multiple other rare diseases since 2007, and the founder of Healing Hugs Haven. Patti is passionate about helping rare, complex, and chronic disease patients gain the skills and confidence to navigate the medical system and work with their doctors to get the care that they need. Welcome, Patti.
Hi, everybody. Let me pull up my slides here. So I am Patti DeMuri, and I am happy to be talking to you today about self-advocacy in the healthcare system. As Jennifer had mentioned, I'm a patient educator, a patient advocate, a rare disease patient myself, and I like to refer to myself as a retired medical mom. My daughter, who had a lot of rare disease diagnosis, is now 28 and totally independent, taking care of her own medical care. So now is my time to be able to give back to others and help you get the health care that you need. So our rare disease journey did start back in 2007. My daughter was diagnosed with EOE. And I remember the doctor telling me, whatever you do, don't go look it up on the internet and don't try to spell it. Since then, we have been diagnosed with 10 rare diseases within our family, and you can kind of see some of the issues that we've dealt with. So we've dealt with a lot of different medical personnel, a lot of different situations. At the time that my daughter was diagnosed, I was married to my ex, who is a pediatric infectious disease doctor. And even though the doctors we were seeing were his colleagues and our friends, we still struggled to get the care that we needed. And it made me realize that rare diseases and these complex issues are a challenge just in general for the medical system, and not just for us patients. When I started going into being retired as a mama bear and being able to just observe in the appointments, I noticed a lot of things that were going on that I hadn't noticed before. I have a background in biotech as a project manager. So I'm really interested in relationships and how do people communicate and how do they figure out how to work together. And one of the things that I noticed is that oftentimes there was a lot of miscommunication between my daughter and the doctor. So the doctor would walk in and say, "How are you doing today?" And she would think about it and say, "Oh, my migraine is really bad today." That wasn't what she made the appointment for, but it was the social construct, and she just kind of fell into that. She didn't realize that she needed to give a broader perspective. And the doctor didn't know enough to ask, and the way the doctors are taught, just their process. They assume that we know what they're asking about. So there's this miscommunication that's going on. And that kind of leads to the misunderstanding that oftentimes we just weren't able to express and share the context of what life looked like accurately enough for the doctor to really be able to help us with what was going on. And I realized it really came from a lack of training. Doctors are not taught how to handle complex rare disease patients, and patients aren't taught about the system to be able to help their doctors help them. So I started coaching my daughter. We started working on it, coming up with ideas, ways to approach this better. And what I have come up with is a framework that allows you to really learn how to advocate, learn how to be able to really be effective when you're in the medical system. And that first step is clarifying. You clarify, what is your goal or desired outcome? What do you want out of the appointment? Then you need to make sure, who do you need to connect with? Who is the right person to help you with that? Do you have a doctor that can help you with that, or do you need to find a new doctor? Or maybe it's somebody within the office that needs to help you instead. This works in a variety of different situations. Then we need to think about, how do we communicate? How do we provide that context? How do we give them the information they need to be able to help us? Then we need to work on how do we collaborate? How do we know how to talk about things, have discussions, do shared decision making? How do we actually collaborate and make sure that the decisions that are being made are the right ones for us? And finally, at the end, we need to do a summary and look at it and say, hey, did this work? Is this addressing my desired outcome? Is this addressing the goals that I had? And then the cycle kind of repeats itself. Today, we're going to talk about one aspect of this, and we're going to talk about how do we make sure that our appointments are focused on what is most important to us. So my daughter was feeling worse. She was having more symptoms. She was really struggling. She came to see her GI doctor, and literally the only thing out of his mouth was, I think it's time to liberate your diet. Not only did she not feel heard and was really upset because they just weren't listening to her, but she also did not get the care that she really needed. And this just summarizes a lot of what the challenges are because we are miscommunicating, because we are misunderstanding each other. So why is it so hard to get the doctor to listen? Sometimes it feels like we go in and we're saying, hey, doc, are you listening to me? And they're kind of over there going, wow, you've got a lot of things going on. I'm not sure which ones we're talking about today. So what is it that the doctor is thinking? What is the process that the doctor uses in an appointment? Let's take a look at that first. They're really looking at what is your problem? What is your chief complaint? Why are you here today? Then they want to think about, well, what needs to be done? And finally, they may ask you, what else do you want to talk about? They may think that you have more than one topic that you want to talk about. So what do patients bring? How does a patient approach it? Well, the patient brings their hopes, their questions, and their fears. We're not always so goal focused because we don't know to be. We haven't been trained how to do that. Doctors are under a lot of stress these days. They have to see so many patients in a certain amount of time. Most of them do not work for themselves any longer. They are working for corporations. They've got a lot of bureaucracy, a lot of paperwork. They were hoping electronic medical records would make things better, but we're not sure that really is happening. So what are some of the things that the doctor has in their head that they're thinking about in the appointment when we come in? Well, there's things like they have to make sure that they're charting properly. They have to remember the details so that they can chart it later. They're trying to identify, what is your chief complaint? Why are you here today? They also have to link that to the ICD-10 codes, which are what they submit to insurance to get paid. Is there going to be testing? Do you need vaccines? Do you need refills? And they often are concerned about the patient satisfaction scores that are put up on things like the doctor sites on the different websites. Now, why is that important? Well, often their employers actually take a look at those and are concerned about them. What are the majority of them talking about? Long waits, things that they don't necessarily have a lot of control over. So they have a lot of pressure on them to make sure that they get the appointment done in a certain amount of time and that they can keep things flowing. So doctors and patients are not taught how to do this. That is a big part of the problem. They're not given the time, they don't have the extra long appointments, and they're not given the support. As patients that have rare diseases, that have complex issues, we put a lot more stress on their office and their office personnel than just a regular patient would. We may need more prior authorizations. We're trying a lot of different medications. We need more coordination, and the system just isn't set up to really support them or to teach us how to help with those things. So what can you do to change this? Is there a solution? Well, when the doctor asks you, why are you here? You can say, hey, I want to talk about this and I want to talk about that, and be very clear so that they can start with the understanding of what your chief complaint is, and that we don't waste a lot of time trying to figure out what that is, or possibly not even getting it right. So what we need are common goals so that we're both working towards the same thing, so that the goals that that things that are most important to you, the doctor also understands that, and we're working together on those goals. We can do it by agenda setting. Just like in any meeting, we can have an agenda and we can say, this is what we're going to talk about. We can think about it ahead of time and bring it in so that things are focused on what's most important to us. So what are some of the benefits to agenda setting? It actually increases the patient satisfaction, which is understandable because you're now focused on the things that are most important to the patient. The patient engagement increases because, again, you're focused on what's most important to the patient, and the patient is engaging. The patient is thinking about it ahead of time, doing some of that work on identifying and clarifying what it is they would like from the doctor. And because of that, it helps improve outcomes because patients are engaged, because it is focused on what they want, and because you're having this conversation with your doctor, the care and the outcomes actually improve. And most importantly, it's a way to get the doctors to listen and the patients to feel heard, which is just a win-win for everybody. So what are some of the reasons why doctors don't do a patient agenda setting all the time? Well, they often feel like it's going to take too long, that they're opening up Pandora's box, and that it's going to be really hard once they ask to be able to make sure that the appointment gets done in the amount of time that's there. Sometimes they think, well, I'm interviewing you. I'm trying to figure out what the chief complaint is, and I'm pretty good at that. I think that I can do that. I don't think I need to ask the patient. They worry that there's going to be too many issues that are brought up. And honestly, they sometimes think that they know what the patient's going to want. Think of a specialist who sees, 20 EOE patients in 2 days. Well, they think that they can just go through and they have a general idea of what people are going to want. So there was a study done in 2018 about patient agenda setting. So they took recordings of patient appointments and they looked at it to find out how many times the doctors actually asked the patients what their agenda was when they were coming into the appointment. 36% asked the patient what their agenda was, so just over a third. And it was about 50% of the primary care doctors, and only 20% of the specialists asked why they were there. Not only did they not ask about their agenda, but the patients were interrupted. 63% of the patients were interrupted by the primary care doctors, and 80% of the specialists interrupted the patients. Now, want to guess how long it was before they interrupted patients? 11 seconds. 11 seconds before you get interrupted when you're talking in the appointment. So you can see why there's so much miscommunication and misunderstanding. Because we don't touch base in the beginning, we aren't starting from the right spot. So only 18% of the patients seeing primary care doctors were asked about their agenda and not interrupted. 18%, so 1 out of 5, and only 4% seeing specialists. So it's no wonder when we walk into a specialist's office that often our agendas aren't aligned because we're not communicating in the beginning. That's the power of agenda setting. If we can do it from the very beginning, then we can make sure that the rest of the appointment is focused on what is important to us. So how do we go about this agenda setting? Well, let's first look at what the appointment looks like from the doctor's point of view. It's a 5-step process, and it starts with the intro. It starts with that, how are you doing today? What brings you in today? That kind of casual talk, but that's the beginning of their interview. That's where they're starting to figure out, why are you here? What is the main problem? From there, they're going to gather the details. They're going to ask you questions. They're going to do the history. They'll do a physical. They want to get all the information so that they can next do the assessment. That may be deciding what diagnosis, what test, what treatments, and then is the decision making. That's where they should be just talking with you, and you should be making that decision together. And ultimately at the end is the care plan. It's a summary of what you've talked about and also what steps you're going to do moving forward. You may also hear some of these terms used with these different steps. In the intro, they're looking for the chief complaint. When they're gathering details, that's where they're doing the history and physical to try to figure out, and that's based on the chief complaint. In the assessment, they may be doing a differential diagnosis, or they may be deciding another treatment. The decision-making step is where the discussion and hopefully shared decision-making is being done, where you can decide together what is the best decision. And then that care plan, that's that summary. And that summary actually gets included in your medical records under the doctor's notes. They summarize all of this and they put down what are the next steps as well. So how does that help us? How does understanding the format of it help us? Well, you can kind of look at it like a funnel. In the beginning is the intro. The topics are wide open. As they figure out what the topic is that you want to talk about, it gets narrower and everything is focused on that topic. And the intro is where that tipping point is. That's our opportunity to be able to do agenda setting with them, to have that common goal, to talk about it in the beginning so that it is focused on what's most important to you. Again, we want to have those aligned goals so that we're all working towards the same thing. So we've talked about clarifying what is your goal or desired outcome. So how do we do that? How do we actually figure out what it is that we want to share with our doctor? Well, getting clarity on your goals really consists of these 4 different areas. It's your priorities and preferences, your values, and your knowledge. And your knowledge includes your knowledge about you, about your body, about things you've tried, about things that didn't work or did work. And it also includes what information you know about your rare disease. So if you know about some of the different options for treatments or for testing, that would go into your concept of what your goals are going to be, what you would share with the doctor. So a couple of questions you can ask yourself are, what do you want to focus on? Why did you make the appointment? What are you hoping to get out of it? What is your desired outcome? So let me give you an example. A couple of years ago, I was having a lot of pain in my shoulder. I was having numbness, weakness. I was dropping things. I was not able to write. Even walking hurt because my shoulder and arm hurt so much. And they determined that I had cervical stenosis. I saw 2 different surgeons. One recommended a surgery just to address the nerves in my arm. It was a much less invasive surgery and a much easier recovery. The second surgeon recommended a full cervical fusion to address the nerve issue and to stabilize the neck. So how do you decide which one's the right one for you? Well, I knew that my goal was that I wanted to be able to write again. I wanted to walk without pain, and I wanted to safely ride horses. And I had been told with the cervical instability that I had that it was very dangerous. So by knowing what my goals were, it helped me identify which surgeon and which procedure was the right one for me. Now, somebody else may have made a different decision, but this helped me narrow down what was right for me. So here's a sentence that you can use that can help you identify not only what you want, but why it's important to you. And that's really helpful to be able to share that and clarify it, not only for you, but also for your doctor, so they understand the context of why it is you're asking for something. So it goes, I want so that I can. We would prefer to do food eliminations so we can avoid medications. I would like to try swallowed steroids so that I can eat at school like my friends. I want help addressing my symptoms so I can be more active and go back to school or go back to work. I would like to discuss the new biologics to see if one might be a good fit for me. There's also a worksheet that will be available for you afterwards if you're interested that can help you walk through this. Once you get the hang of it, you may not even need to use this worksheet, but it's really helpful in the beginning to really sit down and identify what are your values, what are your preferences. Some families prefer to try to do elimination diets. Some prefer to do steroids. Some prefer to try some of the newer medications. What is important to you? What is important to your family? And use that to help your doctor find the right care plan for you. Okay, so now we've clarified what the goal is. How are we going to share it with the doctor if the doctors are not asking us what our agenda is in the beginning? Well, this falls into the communication stage. And let me show you something that is really helpful for this. I've created the concept of an appointment agenda. So the appointment agenda is a tool that you can use for communication. You prepare it before the appointment. It can be written so the doctor can quickly read it and figure out what is important to them. And you can tailor it to whatever situation you're going into. So this is what we did with my daughter when we started having problems. We would talk about before the appointment, usually the day before, I would say, okay, so what's the goal of your appointment? And what are the symptoms? What do you want to share with the doctor? And how can we present it in a way that is straightforward and that is easy for them to read, that they can get all of that context very quickly without us having to do the 20 questions back and forth. So things that are included in it are the goals, and never more than 3 goals, 1 to 3 goals. And the bigger the goal is, the bigger the topic is that you need to talk about, the less you should have in one appointment. You want to be able to have the time to be able to share and to be able to work with your doctor to come up with the right answers. Including symptoms. Now, I recommend for patients that are complex, that have a lot of issues going on, I would put down all your symptoms, but I would prioritize them based on what your goals are. So if there are issues that you want addressed, prioritize those symptoms, put those at the top. But if you do have migraines along with that, if you do have other things going on, it's okay to put that down there and to even tell the doctor, hey, all the symptoms are on there, but these are the ones that are most important for me to talk about today. Now, it does a couple things for you. It helps you get that information into your medical record so that they know it's an ongoing problem. It's just not something that is the focus of today. It also helps when you have disability. If you are trying to do a disability claim, they often say, well, it doesn't look like this is a problem, a long-term ongoing problem. But when you document it this way, you can say, yes, this is still a problem, but that is not what I'm talking about today with this doctor. That is not the primary focus. Remember, we want them to have that context. So the relevant history, and relevant history might include other testing that you've had, other medications that you tried, things that your family members, your family history, your medical history, things that might be related. And then it's really important to include your questions, your concerns, and your fears. Now, doctors talk about the hand on the doorknob, last questions that patients so often ask them. And it's very frustrating for them, and it's not very good medicine for us. It can often take us, we can often be anxious and a little bit nervous about sharing those things. It's hard to speak out loud and say, I'm worried that there's something really wrong. I'm worried that this might be happening. But if we can capture those, if we can put them in a written document, it helps take some of the emotion away from us, but it gives the doctor the opportunity to understand what our fears are, which may lead to answers for us. And if not, for them to be able to help us with those and be able to address those. in a timely manner, not as they're walking out the door, but as part of the primary focus of the appointment. So think about it. What are your questions and your concerns, and especially your fears? Don't be afraid to share those on there. So what are some ways to share it? I used to bring in a printed copy. I'd have a copy for me, a copy for them. I'd ask them to put it into my medical history as I checked in. They would have it ready for the doctor in the office. Nowadays, with COVID and things, they're not as comfortable accepting things from me. And with my chart and email being so much easier, now I just send it ahead of time. For my primary care doctor, she prefers to have it the day before so she can understand what I want to talk about in case she needs to do research, but it's something you can talk to your doctor about. And often the medical assistant can, even if they want a paper copy, the medical assistant can print that out for you as part of the check-in process. You can ask to have it specifically added to your medical records. In my medical records now, they take what I say and they put it as part of the notes, but they also include just the full copy of what I have sent in to them as well as part of my medical record. And it's really helpful to look back on it. You can see what was important. You can see what you were concerned about. You can see what your goals were. And even before the next appointment, it's really helpful to go back and look at that and say, hey, go to the assessment part of the process and say, hey, were those goals met? Did we do a good job trying to move towards those goals? And is it something that I may want to address in this next appointment? So to wrap up, the most important thing I want you to think about is how can you work with your doctor to set those common goals, to make sure from the very beginning that you both know what the goal is, what the desired outcome is, and you're working on it together so that the rest of the appointment can build on that and help you get the care that you need for that. So just a little bit about me and about the business that I've started. I am passionate about really helping more patients. It just breaks my heart when I see people that are struggling to get care. So I have created a membership, and it's a monthly membership. It's low cost. And in the membership, we do workshops and coaching. So we go through, we learn topics similar to what I did today. And then people ask questions. They ask about what is the approach? What can I do? What would you recommend? And so we're constantly moving forward. We're constantly improving, and people are gaining the skills themselves to be able to advocate in their appointments. So some of the workshops we've done have been finding Dr. Right, safe ER care, how to facilitate collaborative care between doctors, how to help with that since the system isn't really set up for that. Let's see. Medical records and medical history, what that means, how to create it for your appointments. How to advocate for yourself, but how to advocate for others as well, which goes for advocating for spouses, for parents, and for kids. And another one was finding your voice. How do you learn how to speak up? How do you learn how to be able to represent not just your goals, but all of that? How do you learn how to be able to speak throughout the whole appointment so that you can collaborate together on a deeper level? So again, if you are interested in getting the worksheet, there is the website there. And I think Jennifer is probably going to share that as well.
Absolutely. I'm happy to share that on APFED's website so that we can make sure that people can access that. Thank you so much for your wonderful presentation. Really appreciate all the insights that you shared from the experiences that you've had with yourself and your children.
Oh, you're welcome.
So you have clearly put so much thought into how to work with providers and get the most out of the appointments to get to those end goals of getting the care that you need. If you have never sat down to think about what is your agenda or what should your expectations be for appointment, how do you recommend starting to frame those thoughts to prepare for an appointment?
I think the first part is just thinking about, why did you make the appointment in the first place? What are you hoping that doctor can help you with? And sometimes it can take even just doing a little journaling, just thinking, just writing, what am I hoping to get from this doctor? What is it that I'm hoping the outcome will be after I see them? And really thinking about, how can you help the doctor do their job? We know that there aren't any cures for eosinophilic disorders. We know that we're complex patients. We know that it's hard. So sometimes it comes down to quality of life issues. How do you find out what's important to you? I know for my daughter, eating was not a real big priority for her. She had a lot of pain. She was not able to go to school. And when she went and saw a dietitian, before she asked her doctor if she could get a feeding tube and go on formula. Her doctor was very concerned. She was sent to a dietitian. The dietitian looked at her and said, well, what are you going to eat at a birthday party? And my daughter looked at her and almost started crying and said, I can't go to birthday parties. I don't care what I eat. I just want to be there. So it's those kind of things where it's not obvious that what the doctors think you would want to do is very different than what each individual person may want. So really thinking about, what are your values? Do you value being able to go out to eat? Do you value being able to do functional things? It's very different for each person, but once you start looking at it from that way, it can help frame those conversations.
Thank you. A question here. One of the challenges I face when going to the doctor is knowing how much to share with the nurse practitioner or nurse that comes in first before the doctor. I feel like I'm repeating myself when I speak to both professionals. What is the best way to communicate in situations like these?
That is a wonderful question. I like to say you need to give data as needed. Like, they need to know enough, but not too much. One of the things that the appointment agenda helps with is that they want to know, because they're trying to find out what that chief complaint is. They're trying to enter things into the medical records. They're trying to prep the doctor before they come in. So if you've already thought about that, if it's very clear, they can take that and use that within the medical records, and they can use your actual words and not something that is interpreted through the doctor.
Next up, what are some ways you found helpful to keep medical information like the agenda or journaling organized, particularly when you're managing different diagnoses for different people in your family?
That is a good question. I personally use Google Docs, and I create my appointment agenda in there for each doctor, and I label it with the date, and I label it with the doctor that I'm seeing, and add notes to it afterwards on kind of what the care plan is. You're going to need to find what works. Some people use Evernote, some people use that, some people use just folders on a desktop. Some people actually write them out, and they find that that's easier. Again, I include them in my medical chart, in my chart as well. So I send them to my doctor as well. So I have that as backup. But I think it can be challenging. The nice thing about including all of your symptoms with the doctor is that even if you're seeing a specialist and you don't know for sure if a symptom's going to be important to them or not, you don't have to share that information directly. They can skim it, and whatever they think is important and they need to follow up on, they will do so. But yet they're all there so that it's a comprehensive picture for them.
Are there particular sections of information that you provide? Is it just like a few sentences? Do you have any thoughts on the formatting of that?
I think yes, I think having it just be more of an outline type thing and not real dense reading has been the most successful with doctors, because they're skimming it. You don't want to write huge paragraphs that they're going to have to read long things. You want them to just get a context so they know what they need to follow up on. And it does change kind of based on what you're dealing with at the time. Sometimes I have more relevant history if there's more testing or more medications that I tried, and sometimes those areas just really aren't very relevant. And there's no set structure. Whatever works for you, and you'll find that you'll kind of get into a rhythm with the doctors as well.
You also talked about how important it is to set the agenda right from the beginning, and shared a lot of data on how few doctors are actually asking about your agenda. So if someone does not ask about your agenda, what is the best way to institute that, or like bring it up in the conversation?
That is a wonderful question. If you send it in my chart, it will be there. You can share it with them, or you can mention it to them as you come in. Or the first time that you bring it in, you can say, I know you're really busy and that we don't have much time. I created this for you to try to help focus us and make sure that I had the right information for you up front, and so that you could see it. Now, I have one person who went and used this and called it an appointment agenda, and the doctor was very offended. They did not like the word agenda. She changed the name to notes. He loved it, and he loves the concept of it. He just didn't like the word agenda. So you need to figure out what works with your doctor. I've had other people that have come back and said, oh, my doctor was just thrilled because it's all there. Like, they don't have to try to do this. You know, they're under that stress, and they're trying to say, okay, what are we going to talk about? What do they need? I need to fix it. And this gives them a way in to say, okay, I understand. I know what the problem is. I understand what they need, and then be able to work from there.
Absolutely. So you've talked a lot about MyChart. There are so many different medical platforms out there, and unfortunately, not all providers have a way to do that messaging. I know, even thinking about my own providers and my children's providers, some of them have it, some of them don't. Do you have any tips for ways to communicate when you're working with multiple care providers in different systems, and to help get them all on the same page?
Do you mean communicating between each other, or for your specific appointments?
Getting communication between multiple providers. So the question was, do you have any tips to help manage communication between multiple care providers so that they're all on the same page? And who takes the lead on it? Is it the doctor, the patient?
Unfortunately, most often the system is not set up to support the doctor to do that. Again, the doctors are under this intense time pressure, and the intention is that medical records should be able to be passed back and forth between different systems. In reality, we know it doesn't always happen. The good news is that your medical notes now have to be released to you if they have electronic medical records. So one way that you could help with that is to just print out the notes from other appointments and actually bring those in. In the past, I used to try to summarize what happened in the appointments, and I was not right. Like, as much as I tried, and I've been around the medical field for a long time, it's playing telephone with somebody who's not at the same, doesn't speak the same language. So if you need to do that, I would say, you know, bringing those notes. Oftentimes they'll ask you, who is the referring doctor? Who do you want reports sent back to? It's really important that that information is correct, because there is process where they're trying to do it. It's not always perfect, but that can sometimes get the notes back and forth. The good news is we can see those notes now. It used to be you had to request your medical records to see the doctor's notes. With the change in the 21st Century Cures Act in April, they now have to release those to you. So you see the communication going back and forth. It's good to know that, to understand that sometimes the notes seem very cryptic and can actually sometimes seem kind of insulting. But when you understand that the doctors are taught to do certain evaluations of you, and there's a general context of how they write things. You know, it's a 21-year-old, well-looking female who doesn't seem in distress. Well, that seems kind of weird to us. Well, that's what they're meant to do. They're meant to give their impression of the person when they walk in. And it's not insulting. It's just always been written doctor to doctor. And now patients are seeing it, and it's changing a little bit. Many of the doctors are changing their vocabulary a little bit, but it's important to realize that we need to learn that language as well. We need to understand what it is they're writing and why it's written in the way that it is.
So when you're preparing for appointments, in addition to providing like your list of symptoms and your goals, are you also providing a list of questions to ask the doctor?
Yes.
Do you have any resources or suggestions for preparing questions in advance of an appointment?
I can actually provide a resource. The oh, and now I'm going to forget, AHRQ, the Academy of Healthcare Research and Quality, actually has an app and a website that has come up with questions for different situations. It has questions for if you have a medical issue, if you're talking about a medicine, if you're talking about surgery, or if a diagnosis. And that's a pretty good place to start. And I can include the link for people as well.
That would be great. Thank you very much. What are some ways that you've taught your children to find their voice to self-advocate at medical appointments?
This concept of having a goal and being able to share with the doctor and them understanding that the doctor has a process. They're trying to figure out a problem. They're trying to fix it. How can you make sure that you can help them along that path? Just taking that 15, 20 minutes before the appointment and saying, well, what do you want? What do you want the doctor to help with? What is most important? Can really help your child start to say, hey, this is what is important. I've even seen it work well with teenagers who are non-compliant, where they at the very least can go in and say, I'm tired. I just want to eat everything. I want to be like my friends. And even if they choose not to do it, at least they're learning how to talk to their doctor and they're learning to say, hey, this is what I want.
You find
and
that
it's not, I have said in the past that I've been coaching my daughter, and coaching can have so many meanings. And it's a word that I'm very careful about now. It's not that I was coaching. I was just helping her think through and prepare so that she was ready for the appointment. So she could tell them what she wanted rather than that in the moment reaction and response, which is normal, but is not always as helpful for us to get what we need.
Has she carried on your note structure and appointment agendas?
Oh, yes. Yep. She does it. And she's funny because sometimes she'll say, Mom, you need to make sure you do this before you go. And so she walks me through the same thing.
That's good that you can support each other in that way now.
Yes.
Let's see. Next question. How long should doctor appointments last? Sometimes I feel like a bother or taking too much of their time, which adds to my feelings of nervousness.
That is a wonderful question. Ideally, in an ideal world, they should last as long as they need to. In the real world, they normally last, 15 minutes for a regular appointment, but there are a couple things you can do. You can ask for a complex patient appointment, which is often longer. It's often a double appointment. I've worked with doctors who have asked if you're complex, if you're going to have a lot of issues, to either be scheduled right before lunch or right at the end of the day, because they do have that pressure to stay on time. So if they know you're going to need more time, they can either find you that longer appointment or put you at a time where it's okay if it goes over a little bit. It's important, I think, though, for us to also respect our doctors and understand we can't have too many issues. We can't expect everything to be fixed in one appointment. Now, I know that we wait a long time. I know that we have a lot of issues. It's the best thing that I have found is to say, hey, I have these other issues. What is the best way to follow up? And sometimes doctors are willing to just do it through my chart. They're willing to do it through a phone call. They're willing to figure out another way. And other times they're going to say, hey, you're going to need to schedule another appointment.
You got a nice kudos here. Great tip on complex appointment booking request. Thank you. Alrighty. So if you get to the end of the appointment and you aren't clear on what your next steps are, and you're having trouble reading the cryptic notes that are in the notes that are handed back to you, what do you recommend you do?
Ideally, before you leave the appointment, you repeat back to the doctor what you think the plan is moving forward, so that you're in agreement, so that you can say, yes, this is my understanding is that we've agreed to do X, Y, and Z, and that I'm going to do this testing and then this and then this. That can often help prevent that situation. I would say if you do have a problem and you don't understand the notes, I would either call or send them an email and ask them to explain it. and make sure that give them your understanding of what happened and ask them from a cooperative place, not from a collaborative place, not from oh, this is wrong, but hey, my understanding was I thought this is what we had decided on. I see in the notes it's this, and that way you can work together to try to figure it out. Electronic medical records are good and bad, but because they have to answer so many questions, they have to do so many things, a lot of it is cut and paste. A lot of it is clicking a lot of boxes. A lot of it is forms that they use. And so it's easy for them, after seeing so many patients during the day, if they go back and chart, to get things wrong. And so if we just say, hey, that's not my understanding, can we work together to fix it? Most often the doctors are willing to do that.
Do you have any final thoughts or tips you would like to share with everyone today?
I think the most important one is that you are the expert on you, and you get to decide. You are the person who's getting the healthcare. You're paying for the healthcare. It's your body. It's going to affect you the most. Be okay with making your own decisions. And really, if something doesn't feel right, if something doesn't sound right, speak up and talk about it and figure out what will work for you instead.
Thank you so much for your time today. We really appreciate you sharing all the wonderful resources and information and tips. As Patti mentioned, we will include links to the resources that she shared today on APFED's website to make sure that you can quickly access them and be able to take advantage of the resources that she shared with us. Thank you, Patti, so much for today. And thank you also to our education partners. APFED's EOS Support Webinar Series is sponsored by AstraZeneca, Bristol Myers Squibb, and Educator.
Thank you so much.
Absolutely. Got a few other resources we'd love to share with everyone today before we completely wrap up. First off, would love to encourage everyone to join our Inspire network. We have a wonderful online community there that you can be able to continue the conversation. You can join there and look at different forums and discussion threads that you can use to be able to continue the conversation and connect with other people in similar situations to yourself. Also encourage everyone to subscribe to APFED's podcast. We have a podcast that's available on Apple and Audible and Spotify and many, many other places that you can listen to. Our most recent episode of Real Talk Eosinophilic Diseases covered eosinophilic asthma. And it really had a great conversation with Dr. Viswanathan. Hopefully I pronounced his name correctly again, but he just had a wonderful advice and resources about what it is, how it's different from other forms of asthma, and things that you can do to advocate to yourself and be able to get the treatment and things that you need for it. We have another episode coming up that should release within the next week, so please stay tuned and subscribe to be able to listen to even more episodes as they come out. If you are looking for even more educational resources and weren't able to join us for our conference this past summer, EOS Connections is still available on demand as our virtual conference. You, as a member of APFED, you can register for free, and there is also a free membership option. So essentially you can register for free. You can go to apfed.org/conference and you can register and access all the presentations. In addition to the presentations, you can still navigate the virtual expo booth to be able to see information from the partners. And you can also navigate the research hall. There's a number of videos from researchers talking about what they've been working on, and there's really a lot you can learn from exploring that. So that will definitely be available through the end of the year. So thank you so much to everyone for joining us today. And thank you again, Patti. We really appreciate you joining us. If anyone has any other questions, please email us at mail@apfed.org. Thank you.
Thank you so much.